Starting recording. We are recording. Five, four, three, two, one.
Good evening, Winnebago community, Winnebago membership, Winnebago workforce. This is the bi-weekly COVID-19 update for the Winnebago tribe of Nebraska. And I wanted to start off by sharing a little bit of my thoughts. 3 weeks ago, I was offered the vaccine, Pfizer, the first dose, and then I took it. And just yesterday, I took the second dose, the booster. And I had my personal story is that I didn't have any side effects, and I see that more and more of our community members and our workforce are taking it. You know, that we have those vaccines available, that we took control of our healthcare, and we have that now, and it's real benefiting us during this pandemic, and that we're going to continue. That there's a lot of work to do, and we've gotten a lot of tools to fight against this pandemic, and that's the next tool, the vaccine, and it's a very important tool, and we need to ensure that we reach a level of acceptance, you know, that we really endorse this as throughout our entities and our tribe and our organization, and so that we can make sure that those who maybe are uncertain that they can make a choice to get the vaccine, that we're all in this together. And I know that I was talking to some of my friends, and that they was trying to encourage their parents to get it. So all that's going on in our community, and I really think that we're moving in the right direction. You know, I'm really encouraged by how we're handling this, and it's a testament to Danelle and Mona and their team and all the hard work that they're doing. So with that, I wanted to pass along and begin the update with our CEO, Danelle Smith. Thank you.
Thank you, John, and thanks for sharing your story. I too yesterday just received my second dose of the COVID-19 vaccine, and it went really well. I just had kind of a sore arm for a while yesterday and a little bit today, but other than that, I feel great. So I would really like to encourage our community to take advantage of this resource that we have, and to get vaccinated. The sooner that we can have people vaccinated, the sooner we can make it through this pandemic and try to get back to some sense of normalcy in our lives. So welcome everybody for joining us for this week's edition of the COVID-19 Community Update. Mona has our updated statistics and data to share and a few other items. Before we move into the presentation, I just wanted to go over a few things from the hospital side of things. We continue to have COVID-19 testing available for the community. So if you have been exposed, or if you're experiencing any symptoms and you need to be tested, please just call the outpatient clinic, and we can get that taken care of by appointment. So COVID-19 testing continues to be available Monday through Friday, and we've added most afternoons. So every morning, Monday through Friday, but we've also added afternoons to the schedule on most days. So just give them a call and they'll get you scheduled. And those appointments are still being done on a drive-up basis. So you can just drive up on the east end of the hospital, and the nurses will take care of you and get your COVID test done pretty quickly and get your results back to you as soon as possible. So we're really fortunate to have continued ample testing available for anybody who needs it. The next item is just a reminder about our visitors policy at the hospital. This is a precaution that we put into place just to eliminate or not eliminate, but to reduce the potential for spread of COVID-19 within the facility and amongst staff and patients. So if you need to come to the hospital, either the ER or the clinic or any of the other areas for an appointment, you are permitted to bring up to one person with you, a support person. If you can come to your appointment by yourself, even better. But if you do need somebody to come along to help you or be supportive for you, that is limited to one person in the facility at a time with our patients and clients. And again, that is just to help try to reduce the potential for spread and reduce the number of people that are in the facility at any given time. The next item is regarding a couple of changes that are going to be happening in our outpatient clinic. I think that Laura might have mentioned this previously on other community updates, but just for those of you who are not aware, we have started assigning primary care providers for each patient in the outpatient clinic. And so this is not something that was typically done before. And our outpatient department and team have been working really hard to put this into place. And basically what it means is that you will have a primary care provider who is assigned to you basically to be your provider for your care in the clinic. And this really helps with continuity of care and making sure that your provider that you see on a regular basis is familiar with your history and can really just help establish a good relationship in taking care of yourself and getting your healthcare needs met. So that has been implemented. And so they basically kind of looked back at the history of your visits and determined who you generally see the most and made those assignments. And if for some reason that you have been assigned to somebody that you're not, that you would not, or if you would prefer, I guess, a different primary care provider than somebody that's been assigned to you, you can just talk to your nurse or call the outpatient clinic and request to be assigned to a different primary care provider. So I just wanted to let you know about that. And there's been a flyer posted on our social media that gives a little bit more details. And if you have any questions, just go ahead and call, and we'll be happy to answer any questions that you might have. The next item, as far as an update that we are working on in the outpatient clinic to help improve care, is an appointment reminder system. We do have this, have appointment reminders in some areas, such as the dental clinic, and we are now moving forward with implementing this in the outpatient clinic. So if you have an appointment, we'll have a system whereby a phone call or a text message or an email can be sent to you to remind you of your appointment. So again, just another update to our operations in order to help you take care of yourself and help us take care of you. And that's it for my updates. And just a reminder to everybody to, even if you've gotten your COVID-19 vaccine, please do remember to wear your mask, wash your hands, and watch your distance. And I'll turn it over to Mona. Thank you.
All right. Thank you, Danelle and John. Thank you both for your testimonials about the second vaccine. I'm sure that's encouraging to everyone. So good evening, Winnebago community. This month has started off with some wonderful and inspirational successes, as Danelle and John both described. The Winnebago Public Health Department, along with members of the 12 Clans Unity Hospital, have started to roll out our COVID-19 vaccine clinics. Our first clinic was a bit of a trial, but wanted to make sure that everything was in place before we really started with our 65 years and older. So as of today, we've been able to do 3 community clinics, administering about 685 vaccines to our community members and essential non-healthcare workers. And yesterday, we were able to start administering the booster, the second dose, to our essential workers, as John described. So we're moving as quickly as possible. And so please go like the Winnebago Public Health Department's Facebook page. We definitely have all of our activities and everything that's going on posted there. And right now, I know that I've had a lot of questions, but right now we're currently still using the Pfizer vaccine. But it's really allowed us to move as quickly as we can. So I will start this week's presentation. All right, so the new status report today, we are currently reporting 1 new positive case. We have now 2 active cases in Winnebago for a total of 319 positive cases since the start back in April. 312 have recovered. We had 5 deaths currently related to COVID, and right now we have 4 households in quarantine. Total initial doses of the vaccine administered in Winnebago has been 874. So we have been able to provide 301 additional, or the second doses, the booster doses, to people. And so that gave us a total vaccines administered of 1,175. So just the gender, looking at the age breakdown for our COVID positive cases, you can see that 20 to 29-year-old is about 28%, followed pretty closely by our 0 to 19 years of age at 25%, and then 30 to 39 at 16%, and then 40 to 49 at 14%. Our gender breakdown is pretty close, with the females being at 53% and our male population being at 47%. Our COVID-19 close contact report, right now we had 147 that were isolated cases and 172 that were linked to a contact. All right, for our exposure areas, we had 172 that were positive either within the household or identified as a close contact. 77 that were related to social gatherings. We had 46 family gatherings, 13 that just weren't sure exactly where they might have contracted it from, and then 8 related to meat packing plants, and then we just had a few others that identified from like a cultural gathering, shopping, or possibly incarceration. So this just shows the positive cases over time since our first case back in April. And then it just shows the trends of the peaks and valleys, and you kind of can see from the different possible events that happen with mainly like Thanksgiving, Christmas, some of the summer activities. And so our COVID-19 vaccination distribution, we've been really trying to follow. We did our healthcare workers and first responders, and we continue as people decide to want to be vaccinated. We're still working on our non-healthcare essential workers, such as our teachers, police, spiritual leaders, and other knowledge holders, as well as our elders 65 years and older. We did start opening up last clinic to our adults with chronic disease. And so we will continue to prioritize those areas, but we are asking people to sign up on the waiting list. We have the health department, and then also by calling the PHN department at 878-2258. So the vaccine waiting list, you can sign up at www.winnebagopublichealth.com vaccination waiting list. You must be 16 years or older, live within the Winnebago service delivery area, and also be a patient at the 12 Clans Unity Hospital or the Winnebago Public Health Department. Or you must be a person that's working on the Winnebago reservation are also eligible. So all participants must be willing to receive their initial vaccine and then the booster vaccine 3 weeks later. And of course, it says supplies are available. A representative from the Public Health Department will contact you regarding your vaccination appointment. Thank you for watching the COVID live. Oh, go ahead, Emily. I'm so sorry.
I was going to say thank you. Thank you, Mona. So as a reminder, you can email the questions you have regarding COVID-19 to COVID@Winnebago Tribe for 2 weeks from now, our update then. So we will go ahead and move it along to an update from the Winnebago Public Schools with Dan. Dan, are you there?
Yeah, sorry. Good evening, everyone. A reminder, the first semester ended today. The second semester starts Monday, February 1st. A majority of the kids that were homebound are coming back next semester. And so with that, we're following the safety protocols. We have that, and it's going to be real essential that we continue to follow that with the death shields and the mask as we go on. The vaccination clinic being held in the gym on Wednesdays is going well. WPS will continue to host the clinic until the vaccination needs of the community are met. And it seems to be going real well. A lot of our staff had their second doses yesterday. I myself never had any side effects. So it seems to be going well. I haven't heard of any of the other teachers that had that yet. Some data regarding COVID. This past month, we had no additional certified or classified staff members test positive. We had a few students test positive, but very few. That number is going way down. Nurse Julie, the other thing we have here to offer is Nurse Julie, Brittany Markovy, and Adam Tramner were trained to give the COVID test. So far, we've administered 12 tests to staff, and all have come back negative. So that's good to hear that, and it gives us a chance if somebody comes in and says they're just not feeling right to get that done right away. So that's been very good for us. Teachers after next semester will be available on Mondays, Tuesdays, and Thursdays for 9-12 students tutoring, and on Mondays, Wednesdays, and Thursdays for 7-8 students for tutoring. Winter activities are in full swing. Please be aware that every site has different mandates as far as spectators. Mr. James will continue to send out information prior to each event. This week, we start the conference basketball tournament. The girls will be at playing Creighton, I believe, at Ponca, or it might be Randolph at Ponca. And then the boys are in action on Monday night. The girls' state wrestling is this weekend. We have 2 young ladies down there, and hopefully everybody saw the article in the Lincoln Journal about Zariah making an impact of her girls wrestling in the state of Nebraska. So that was very positive for Zariah and the community. Other than that, we just need to continue to stay safe, and we'll follow the protocol up here at school. Thank you.
Thank you, Dan. Next, we will go to Manoj with an update from Little Priest Tribal College.
Good evening, everybody. Hope everybody's doing well. Again, I want to take this time to thank the Winnebago Comprehensive Health System, the public health system, for doing a fabulous job in the vaccination drive for the entire community. So I've completed my first dose and will have my second dose next Wednesday. Did not have any symptoms after that. So again, it's just been a fantastic drive so far. So, and congratulations to all the team members who are involved in this. Update from Little Priest Tribal College. One of the initiatives from the president's office we took is to make sure that all employees should be vaccinated. So initial drive in our surveys came to 52%. And then we reached out to all the people to get to find out their concerns and anxieties. Now I'm happy to share we are at 88% of the employees. So 4% of the employees cannot be vaccinated due to pregnancy, they being a new mom, and the doctor's restrictions. So we are at 92%, I would say. So we're 8% who have their own concerns. The spring semester is off to a great start, as we all know. As we all know, that the students are back on campus, and we have 113 students this spring. This is probably the first semester where the fall enrollment and the spring enrollment are exactly the same. Usually, spring enrollment is usually lower than fall. Due to the fact that Little Priest Tribal College is now offering free dual credit courses to all the high schools, including Winnebago Public Schools. So if you're a high school student interested in taking a college course, consider a dual credit course, it is free of cost. And that has made an impact on an enrollment. Extremely delighted to share the opening of our new buildings. The Fish Clan and the Pigeon Clan The Fish Clan is our IT building. The Pigeon Clan is our new dorm. Both are functional. Both are in operations. It is a testament to our hard work and to the dedication of all the employees to make that happen. We are also finding out the new funding we are going to get to the college for the new, they call it as a CRASA funding, or the CV4 funding. And we might be lucky from the Little Priest Tribal College to receive a significant amount of funding. The final details have not been discussed. There is a meeting tomorrow where they will be finalizing the exact amounts and when we'll get the money. But this is this will help our community to continue higher education. Also, the classes are going very smoothly. Students are wearing masks, social distancing, and after a long wait of 12 months, we have started what's called a journey to normalcy. So starting next month, all our meetings will be back to face-to-face. Of course, we are using our auditorium. We are using social distancing. They have to wear masks. All those things are in place. But this is a light at the end of the tunnel, and I'm really glad to see things improving. So I extend my thanks to personal thanks to everybody for vaccination, and I hope we as a community come together and put this pandemic behind us. God bless. Take care.
Thank you, Manoj. Next, we'll go to Sam with an update from HCI. Sam?
Thank you, Emily. I have two quick updates to share. First, I'd like to talk about a new little free library in Winnebago, located in the entry of Village Place next to Dollar General. This is a community project Ho-Chunk Inc. interns started last summer and is continued by our winter interns. It's similar to other little free libraries you may have seen. The idea is simple: take a book, return a book, or when you're done, return a different book to share. The library is stocked with a range of reading materials for different ages and interests. And there's also disinfecting wipes next to the book return. Again, this is in the Village Place entryway. That's the building next to Dollar General. And speaking of summer interns, our deadline is approaching for the summer 2021 program. The deadline is March 1st, but please encourage college students to begin collecting their application materials now. You can submit online. You can get the link on the Facebook page for Ho-Chunk Inc. Community Engagement, and you'll see the internship program right at the top. So thank you for your time. Those are my updates for this evening.
Thank you, Sam. Lastly, we will go to Brian with an update from Winnebago.
Good evening, community. I would also like to extend my congratulations and thanks to the hospital, to the organizations and the team members out there making this all happen for everybody with these vaccines, protecting our community. I too have had my first vaccination, and by next Wednesday will take my second dose. My only thing was a sore arm for a little while as well, so kind of lucky in that aspect. And again, encourage anybody that is available and to sign up, get your time frame, and vaccinate to keep everybody safe. From Winnebago, it's still business as usual. Mask up, we take your temperatures when you're coming in, respect everybody else with social distancing, sanitize, wash your hands. The only other update we had within the last couple of weeks was we did build a few smoke shacks for the people because of the weather. At this time, you can go out and smoke in an enclosed area. It has heat, it has light for evenings. That's not outdoors. They're not very big, so please respect everybody's distancing in there and stay safe. It is temporary. We are looking at another option. If we get the capabilities and the parts, we will build a tent out there that also has heat for that reasoning, because there are a lot of people that like to smoke. Within the facility itself, we're still staying no smoking. for safety reasons, 18 and over, just to be safe. So again, thank you for your time. That's our update from Winnebago Casino Resort.
Thank you, Mayan. Next, we will go ahead and move to the question and answer section of tonight's community update. So you can submit any questions you have regarding COVID to covid@winnebagotribe.com and via email, and we will do our best to answer them. So these are questions that community members have submitted, and we will go ahead and start answering them. So the first question is, do you recommend we double mask? Mona, can you answer that one?
Sure. The CDC has not come out with recommendations in regarding to double mask, but again, everyone 2 and older should wear a mask in public. Masks should be worn in addition to staying away 6 feet apart, especially around people you don't live with. Wear your mask over your nose and mouth and secure it under your chin. Fit the mask snugly against the sides of your face. And just, if you have to continually adjust your mask, it might not fit. So you might want to try a different one. And then really just make sure you can breathe easily through your mask.
Okay, thanks for that answer, Mona. Next question, when will the hospital, or if the hospital will ever offer in-home COVID-19 test kits? Janelle, can you answer that one?
Yes, thank you, Emily. At this time, the hospital is not considering offering any in-home test kits. A lot of the test kits that are on the market for that would be similar to, like an at-home pregnancy kind of test, and not something that would be administered or distributed through the hospital. We do have plenty of COVID-19 tests available through our lab. And so anybody who needs or wants to be tested for COVID-19, we do have the resources to test you. We can do that through our drive-up clinic, as I've mentioned, on the east side of the hospital. And all you have to do is call the outpatient clinic and schedule an appointment. And it just, takes a few minutes. You drive up and they, do the swab and send you on your way. And they will contact you by phone with your test results. If you are an individual, for some reason you're unable to leave your home, like an elderly person or somebody who has some kind of condition that prevents them from coming to the drive-up testing clinic, we can, I would encourage you to contact the public health nursing department, and we might be able to arrange to actually send a PHN nurse out to your home to do that testing there. For some reason you're not able to come into the clinic. So we have a variety, we're trying to make it accessible and as easy for you as possible. So those are the resources that we have available now.
Thank you, Janelle. And a reminder, in addition to that, the COVID hotline is the 922-1508 and still available for community members Monday through Friday from 8 a.m. to 4:30 p.m. All right,
Okay.
Next question. Is what is the best guess on when the pandemic will end? Mona, can you get your insight on what you think that would be?
Sure. So if the vaccine can be distributed widely around the country and we get to the point where at least 80% of the population is vaccinated, then I think we will start to see a slow return to a somewhat normal. So I would probably, if I have to guess, I would say no sooner than summer or early fall, and that would probably be the soonest I've heard.
Okay, thank you. Going back to Danelle, we had a couple questions on what the big trailer in front of the hospital is. Danelle, can you talk about what it is?
Yes. The trailer that's sitting right in front of the hospital is a mobile pharmacy trailer. And we are in the process of getting all of the processes and supplies and things to equip that, and just figuring out the best approach to utilize that in order to provide increased pharmacy services for our community. So that's what that trailer is. The other thing that people may have noticed in our parking lot is a mobile clinic, which is actually kind of a drivable unit. and that is parked in our parking lot, and that's a mobile clinic, and it has 2 exam rooms in it. So just another set of resources that's been made available to us through funding through the CARES Act. And our team is also in the process of getting the supplies for the mobile clinic and figuring out the processes and the best ways in which we're going to be able to deploy that, just to increase the healthcare services and mode in which we provide healthcare in our community.
Thanks, no, that's great. And I'm sure there's plenty of more information on those to come. So, all right, next question. How many people have been reinfected with COVID-19 in Winnebago? Mona, can you answer that?
Sure. Thank you, Emily. We've been monitoring this very closely. We have no one that has tested positive that has retested positive at this time. If we do have a reinfection, we will surely notify the community immediately with the dashboard that Emily puts out.
Okay, thank you. Next question. If you get the vaccine, can you still spread COVID-19? Mona, can you go ahead and answer that one?
We also don't know whether getting COVID-19 vaccine will prevent you from spreading the virus that causes COVID-19 to other people. So even if you don't get sick yourself, so we will continue to monitor the CDC for updates in relationship to that.
And kind of in relation to that, Mona, a couple of people have asked if the vaccine can change your DNA. Is that true?
No, the COVID-19 is mRNA vaccine, so they do not change or interact with your DNA in any way. So really at the end of the process, our bodies are just really learning how to protect against future infection so that our immune response makes antibodies to protect us from getting infected with the real virus.
Okay. And last question was from an out of area, but a tribal member. Are they eligible to get the vaccine?
So at this time, we've really only received vaccines enough for our current service unit, as well as our essential non-healthcare workers. But anyone that wants to sign up for the vaccine is more than welcome to sign up on the online waiting list that we've launched on the Winnebago Public Health Department, as well as the 12 Plans Unity Hospital's Facebook page. So we are doing the best to prioritize our immediate community members, essential workers, and tribal members from the surrounding areas within our service area. And so if at one time we have more than that, we will certainly start looking at that waiting list and contacting people as we're able to.
Great, thank you. And as a reminder, that web address that you can sign up and fill out the waiting list form is www.winnebagopublichealth.com/vaccine waiting list. And you just submit your information on there, and it will automatically go to our public health nursing department, and they'll put you on the list and contact you with more information and instructions when it is available. So that concludes today's community update. Thank you all for your time and for watching, and tune in 2 weeks for the next community update. Thank you.
Thank you.
Thanks, everybody.
Thank you.